Hello friends, a new week, a new MCQ. The clinical case based MCQ as I have already promised, or this was more of a problem solving type MCQ. The next level MCQ as we like to call it. It was related to the respiratory system and many of you have tried to answer the question, but none of you could answer it correctly. So let's have a look at the MCQ first and then we will take the things from there on. Uh, Before going into the space, an astronaut's body functions are being assessed. Now, astronaut is the case which is used here. Um, that should not worry you much, because what you should see in the MCQ ultimately is what is being asked rather than getting lost into the jargon of words. So let's have a look at this. Body weight 200 pounds. It's given in pounds instead of kgs. Then tidal volume 600 ml, stroke volume 80 ml, and resting heart rate 75 beats per minute. And respiratory rate, the resting respiratory rate is 11 cycles per minute. So cardiorespiratory functions of this particular individual, the astronaut, is given here. And what will be his ventilation perfusion ratio inside the spacecraft? So now we get it. What is asked? The ventilation perfusion ratio. Where? Inside the spacecraft. Let's say in the spacecraft. Which means what? Which means when the gravity is eliminated. Let's say in the zero gravity, what will be the ventilation perfusion ratio? That is what we are going to find out in this MCQ. So let's begin and first understand the concept of ventilation perfusion ratio. Unless you know the concept, it will be difficult to solve such MCQs, even though mathematics is involved in that, but the concept is more important. So what is ventilation to perfusion ratio? Commonly called as V to Q ratio. V stands for ventilation, Q stands for blood flow. Q is flow, in the Ohm's law. So Q is flow, blood flow. The ratio is alveolar ventilation per minute upon the blood perfusion to those alveoli per minute. So, how much air is ventilating the alveoli every minute, and how much blood is flowing alongside those alveoli every minute? That ratio is the ventilation perfusion ratio. Let's take some arbitrary figures first. We inspire the air, atmospheric air, and it goes through the respiratory passages, finally reaches the alveoli. This is a diagrammatic representation. There are million alveoli. Say this air reaches the alveoli. Now, in each breath, let's say we have inspired about 500 ml of air, out of which roughly about 150 ml stays in the dead space in the respiratory passage, and only 350 ml will reach the alveoli, and this is the air that will take part in the gas exchange. But this is what is called as the alveolar ventilation in each breath. Okay, now if we know this, how much air is inspired in each breath, how much is the dead space volume, then we know how much air is reaching the alveoli in each breath. And if we know how many such breaths per minute, respiratory rate per minute, we will know how much air is ventilating the alveoli per minute. This is what is called as alveolar ventilation, liters per minute. And the denominator or the other factor in the ratio is perfusion, blood perfusion. Now, right ventricle pumps the blood and it circulates through the lungs. It's the cardiac output. Normally about 5 liters of blood is pumped every minute by each ventricle. So right ventricle will pump out 5 liters of blood and it will circulate through the lungs. That's the blood perfusion. So cardiac output will be required to be known to know how much is the blood perfusion in the lungs. Okay, and this is what is the ratio. So if this concept is clear, now we can talk about our MCQ. Let's see what data was given. Well, body weight is given. Many students could not fathom, could not understand why the body weight is given in this. Let's find out. Tidal volume 600 ml. And what was the other thing required? Dead space volume. Right. Now, let's calculate this here. Okay. So tidal volume 600 ml. In each breath, the person is inspiring 600 ml. And out of which the certain amount will stay in the dead space. Okay. This is tidal volume. And what was the dead space volume? Now, many people take it as 150 ml, but that's not the case, you know. It varies from individual to individual, and the dead space is calculated roughly as 1 ml per pound of the body weight. That's it. That is why the body weight was given in pounds. So, in this individual, the dead space volume would be how much? 200 pounds, so 200 ml. All right. So we have found out the dead space volume also. Now, inspired volume is 600 ml. Out of that, 200 ml stays in the dead space. That means 400 ml is reaching the alveoli in each breath. Right. And how many such breaths per minute? That is also given, 11 cycles per minute. That means what will be the alveolar ventilation per minute? 400 into 11 would be what? 4400 ml or 4.4 liters per minute. That's our alveolar ventilation per minute in this particular individual. 4.4 liters per minute. Next, it also talks about the cardiac output, but not directly. Stroke volume is given and resting heart rate is given. Stroke volume into heart rate is the cardiac output per minute. So 80 into 75, that would be how much? 8 7 56. So 6 liters per minute. Well, that's right. The cardiac output is 80 ml into 75. That means 6 liters per minute. Stroke volume into heart rate, that's cardiac output. And therefore, the ventilation perfusion ratio in this individual would be roughly 4.4 upon 6. If you just back of the envelope calculation, 4.5 upon 6 is 3/4, isn't it? And therefore, if you solve this, it comes out to be what? 3/4 means 75% or 0.75. So that was the answer to this MCQ. 0.75. Many people chose to take it as 0.8 because they knew normal ventilation perfusion ratio is 0.8, and that option was also there, and therefore many students chose to take that as the correct answer, but that was also not correct. It was 0.85. Anyways, now you know how to solve such MCQ. Finally, last point. Would it matter if they have mentioned that it is in the spacecraft? Now look, average ventilation perfusion ratio is 0.8 normally on Earth at 1 atmospheric pressure, and because of the gravity, it varies from apex to base of the lung. That's the effect of the gravity. Okay, it's different at the apex because, you know, heart, when it pumps the blood towards the apex, that is going against the gravity, and therefore perfusion is less at the apex compared to the ventilation. And as you go to the base, heart is pumping the blood towards gravity and the perfusion is more compared to the ventilation, and therefore ventilation perfusion ratio also is different at the base. But this is the hydrostatic factor, effect of hydrostatic factor or effect of the gravity. If the gravity is eliminated, the average ventilation perfusion ratio normally on earth it would be 0.8, or in this case where the data is given it would be 0.75. So that was the answer, and that is how you were expected to solve this MCQ.